So now I would like to invite Associate Professor Nguyễn Phước Bảo Quân, President of Sub-Society of Ultrasound in Vietnam, he will present the topic clinical applications of microvascular ultrasound in the characterization of liver tumor. Professor Nguyễn Phước Bảo Quân, please.
First of all, I would like to have Christine welcome to all the Dr. Shiny expert in the ultrasound field to come to here to share year's knowledge with the Vietnamese college. And the second, I would like to thank you, organizer committee, to invite me to come here to share my knowledge in the regarding the topic of micropulse ultrasound and of liver tumor new development technology. This is my purpose of the presentation. The first, I would like to introduce a new technique of ultrasound for investigating the microvasculature in the liver tumor. The second, to understand the physics practice of the technique and to introduce the performance of the technique in characterization of the focal liver lesion. This is the content of my talk. As you know, this is a sample classification of liver tumor based on the origin of the cell of the tumor. We can divide two kinds of the epithelial origin tumors and non-epithelial origin tumor. And in the epithelial origin tumor, we divide benign tumor and malignant tumor. The most common malignant tumor of the liver is hepatocellular carcinoma, and the most common benign tumor is the hemangioma. Now we talk about the tumor angiogenesis. When the tumor larger than 2 millimeters, they require the proper vascularization. And many research prove that the process of the angiogenesis needs many angiogenesis factors like VEGF, VPF, DGS. These factors depend the tumor size of the tumor. So the tumor vessel network distribution and morphology is different from that of the surrounding tissue, as well from that of the other kind of the tumor. You can see this picture in the normal surrounding tissue. We can see the normal vessel is display organizer and hierarchical branching pattern. Vice versa, in the tumor vessel, they have non-organizer and less of the hierarchical distribution. Even they have a chaotic morphology, particularly in the hepatocellular carcinoma. Now we talk about the daily practice of ultrasound to investigate the vascularization. We have a conventional color Doppler, and we have a contrast enhanced ultrasound called CUS. As you know, in the 1990 decades, Tanaka has own proposed suggest 4 patents of hepatic tumor vascularization. Most of the HCC have a package pattern and was in the tumor and vessel in the tumor, something like this. And metastasis have a diffuse pattern, something like this. And hemangioma have a spot pattern, so like this. However, the conventional Doppler have many limitations. For example, the conventional Doppler ultrasound can detect the vessel larger than 1 millimeter only, and can detect the vessel with velocity more than 5 centimeters per second. Meanwhile, micro vessels have a diameter inferior less than 200 micrometers and velocity less than 2 centimeters per second. So that is a limitation of the conventional color Doppler. Now we move a new technique for investigation microvessel. We use the CUS, contrast enhanced ultrasound. They use the gas bundle with diameter around 2 and 8 micrometer. So this is contrast agent who injected into the flow that can investigate. So the contrast agent were injected in the flow to investigate the microvessel and hemodynamic enhancement of the tumor. This is a method can detect the vascular pattern of the focal liver lesion, particularly in the arterial phase. This phase is very important because it provides information on the degree and the pattern of the arterial vascular supply of focal liver lesions. And the result of multi-center research NGUYEN 2008 show that CUS can detect and can differentiate between the focal liver lesion based on the typical vascular pattern. For example, in the hemangioma, CUS can detect the peripheral nodular enhancements. In the focal nodular hyperplasia, the CUS can detect the spoken wheels pattern, and adenoma, we can feel the centripetal filling. Vice versa, in a malignant tumor, particularly in the hepatocellular carcinoma, the CUS can detect the hemodysmorphic vessel, chaotic vessel, and non-hepatocellular carcinoma can define the ring vessel, peripheral vessel distribution. But the CUS have this disadvantage. You can see the CUS is not available over the world. In Vietnam, we still have no contrast agent for dietary practice. And another drawback of the CUS is a certain restriction regarding contrast agent use, particularly the cost burden on the patient care. You can see the price of the CUS is very high compared to the other contrast agent. So we move to the new technology for detect the microvessel. We can have many treatments of these techniques: microflow and microvascular and microvascular imaging and microflow imaging. The techniques detect on 2014 by Canon Medical System. The technique permits to detect the final vessel and lower velocity blood flow without the use of contrast agent. This slide shows how to difference between the Doppler technique and the new technology of the microvessel ultrasound. In the conventional Doppler, you use wall filter, so eliminate the flow frequency of the motion artifact and Doppler signal flow from the small vessel slow flow. But in the new technology of microvessel ultrasound, you use the specific filter to eliminate only the artifacts and keep the Doppler signal from the small vessel and slow flow vessel. So the advantage of microvessel ultrasound, we can detect the very small vessel, less than 200 micrometers, with high resolution, high frame rate, and low artifact, and semi-quantitative can calculate the vascular density of the tissue. The study proved that the microflow ultrasound can better than color Doppler, conventional Doppler in identify the tumor vessel. And this is a study of the Dr. Giảng and et al. In a prospective study, they investigate the 92 hepatitis hemangioma and confirmed by CT and MRI. They have to prove that they prove that the most frequency pattern of hepatitis hemangioma were the strip-ring pattern or nodular ring pattern on dot line pattern like this. And another study of the Taiwan cans investigate the CT2 FNH focal nodular hyperplasia confirmed by MRI, and they show that there is no significant difference between the microvascular and COS in the test the spoken well side to diagnose the focal nodular hyperplasia. And this is a study of Dr. Hay. They study on 31 focal liver lesions, and they show that there is 7 patterns of vascularization of the tumor, and most of the hemangioma have a diffuse dotted line, stream line, nodular rim line, and A, B, C pattern, and the focal nodular hyperplasia have a spoken well type, and HCC have a diffuse Honeycock type and no specific types, and Metastar have a streamline and thick green type types. In my personal collection, published in the Vietnamese Journal of Vietnam Society of Radio and Nuclear Medicine, we also find 7 patterns of the vascularization. This is a case of hyperechoic in the right side of the liver, in the right lobe. In the microvascular ultrasound, we can see the typical of the peripheral nodular pattern of the vessel. So we can diagnose the hemangioma. This is the CT scanner, hemodynamic CT scan of the patient. And this is a case of, you can see clearly the spoken view size of the focal nodular hyperplasia. In a color Doppler, conventional Doppler, the color Doppler, the signal of the Doppler is very few, cannot talk about this, the kind of the tumor. But in the microvascular ultrasound, you can see the spoken well clearly. So we can diagnose this. This is a case of the focal nodular hyperplasia. And see another case of focal nodular hyperplasia with the spoken well size inside. And this is CT scanner of the patient. And this is a patient of chronic hepatitis B. In a surveillance screening ultrasound, we can find a small lesions hypoechoic. With conventional color Doppler, we cannot say about this kind of the tumor. But in the microvascular ultrasound, we can see this countess pattern with this small fish vessel. So it's easy for us to diagnose this hepatocellular carcinoma in the patient with chronic hepatitis carcinoma, hepatitis. This is the CT, hemodynamic CT of the patient. And another case of metastasis from the breast cancer, you can see the peripheral distribution of the vessel, and this is the micro ultrasound. We can see clearly the peripheral distribution of the tumor, of the metastasis on the liver. We talk about the limitation of technique of microvascular ultrasound. This is the technique of base Doppler technique. So have a limitation in the penetration of the technique. So it's difficult to investigate the tumor located more than 8 centimeters, and particularly in the tumor located in the left lobe. that is significant to investigate the vascularization of the tumor due to the cardiac pulsation. And anyway, microvascular ultrasound technology integrate only in the high end of the machine. So I hope in the future, the technique can integrate in the low end of machine. So it's popular for us to investigate the microvascular vessel of the tumor. So take-home message, we can have two situations. The first situation with in the case of incidental or no suspicion of malignancy of the lesion, when you can see the specific pattern, you can diagnose it. For example, when we see the spoken well pattern, we can diagnose the F and H. And when we saw the peripheral gene, nodular gene of the tumor, we can diagnose the hemangioma. In case of suspicion patient, for example, the patient with cirrhosis or chronic hepatitis C or B, when we can see the pattern of Countess or dysmorphic vessel, we can diagnose the HCC. And another case, we can suggest the patient go to the CT or MRI with contrast enhancement. So for conclusion, we suggest that this technique of microvascular ultrasound, this is a Doppler-based technique, and this is a novel technique. Is very helpful to investigate the microvessel, to investigate the distribution, morphology, density, particularly in the microvessel. This technique is shown that it outperforms conventional Doppler in investigating the microvessel. And initial studies show that common malignant lesion, for example, HCC or metastasis, and most common benign have a broad pattern, different pattern of the vascularities. So, but it is required that more study on microvascular ultrasound for differentiate focal lesion will be conducted to gain consensus on the classification of the pattern vascularity. Thank you for your attention.
Thank you, Professor Nguyen Phuoc Bảo Quân, for your very interesting presentation about microvascular ultrasound in application of microvascular ultrasound in characterization of liver tumor. So, if you have any question from floor, you should give him at the end of the session. Thank you, Professor Nguyen.